Dr. Otabor, the MD of Alliance Hospital, Abuja. Health tourism, let's conceptualize it. What's the meaning?
Well, simply put, health tourism refers to a movement of people across an international border for the purpose of seeking healthcare. Over the past several years, let's say about 20 years or thereabouts, the number of people leaving the country for the purpose of healthcare abroad has increased tremendously, and that can be as a result of the pull and the push factors. The push factors, what is pushing Nigerians away? Scarcity of quality medical care here, and incessant strike by healthcare workers, lack of quality control, and so on and so forth. And then what is pulling them over there? An organized system, a beautiful environment, and qualitative healthcare. So those are the main factors that translate to health tourism, moving people from Nigeria to countries outside of Nigeria.
Where are we getting it wrong? Whether it is pushing or whether it is the one receiving them, where are we getting it wrong?
There has been a lack of investment in healthcare in Nigeria. You know, in 2010, not 20, was it 2010? 2001 first, the African heads of state, they met and they decided that 15% of the federal budget of each country should be invested in healthcare, because that's the basic minimum that is thought to make the healthcare system effective. And all the heads of state signed to that document. It's called the Abuja Declaration.
2001?
Yes. But about 24 years after, we have not even come close to 15%. The highest that we have done is 6% of our healthcare budget on health. And 6% is paltry. By the time you finish paying salaries and other personnel costs, the budget is run down. And not even all that budget is released. In the private space, a lot is happening now to reverse the trend of medical tourism. Yeah. Come to think of it, which hospitals do Nigerians go to when they travel abroad? It's private hospitals. In India, the government hospital is not better than Nigerian government hospital. But in the private environment there, because of government support in terms of funding, they give them loan at very low interest rates. They've been able to build world-class hospitals that are attracting Nigerians. So we can do the same here, and in fact, the same is already being done. Most of the places where rich Nigerians go to now in Nigeria are private hospitals. And by that, we're trying to reverse the trend. And many Nigerians in diaspora now are actually coming back to Nigeria for their procedures. I mean, I can give an example with our hospital. In Alliance Hospital here, we receive a lot of patients who fly in from UK, from the US and Canada to have procedures in this hospital and they go back. Because what people are interested in is, one, safety profile, and two, an organized system. It doesn't matter where the hospital is, people will come in to do it. So that's the hope that we have. And not just Alliance Hospital. There are other moments of brilliance across the country where people are doing big things now, and that is helping to reverse the trend, especially under this economy where things are quite difficult and the exchange rate is quite high, and it takes a lot to go abroad now for treatment. So people are asking for the alternatives in Nigeria, and they are getting it.
You mentioned that the strike, it's one of the things that will hinder people from going to hospitals in Nigeria. Who do you blame?
Well, it's not a matter of blame now. It's a matter of what needs to be done. It still boils down back to investment, because most of the people who are going on strike, nobody just wakes up and wants to go on strike. The doctors that are going on strike, they are going on strike for a reason. First of all, their welfare is not being attended to. The alternative to strike is brain drain. When people start asking you for things, when your professionals stop agitating, just know that they are packing their bags and they are leaving. So, would you rather they leave, or would you want to listen to them and attend to them when they go on strike? Strike is not even as frequent as before now, because doctors and other healthcare providers, they have found a better way, which is to carry their bags and leave. So we're not looking for who to blame in terms of the reason for the strike. Rather, we should be talking of what should we do, and what to do is to invest more in healthcare, invest in liquidity for the hospitals, invest in equipment, invest in the welfare of the personnel. That will keep them happy and keep them to do a good job.
Apart from investment, what other measures do you think government should employ to improve the health sector and attract health tourism back to this country?
Health insurance is still at the babyhood stage. I'm impressed with what the Minister of Health is doing in recent times, because was it last month they launched a scheme to make it compulsory for all public sector to key into the social insurance, the health insurance scheme. That's a good one, but they need to do more than that. The informal sector has to be brought into the health insurance net, because that forms the bulk of the Nigerian population. So the vulcanizers, the tailors, the bricklayers, the spare parts sellers in the market, the clothes sellers, the food sellers, those are the bulk of the Nigerian people, and they form the bulk of the Nigerian economy. We have to find a way to get those people under the health insurance. When we do that, there's a pooling of resources, and then there will be massive investment in the healthcare, and that would translate into improvements in the funding and the healthcare of the people. And then that also solve the problem of universal health coverage. People don't have to have money in their pocket when they are sick before they can access healthcare. Because if you depend on having money in your pockets, not too many people would have money in their pocket all the time. And just for lack of 20,000 naira, some people can actually lose their lives. That's why that's why insurance is important, so that people pay for their healthcare when they are well, so that when they are sick, even when they don't have money, they can still access healthcare. By and large, talking about Nigerian healthcare at 65,
Yes.
truly, there are too many factors that contribute to healthcare other than hospital and doctors. And if we don't address all those issues, we will miss the mark. As we speak today, Nigerian life expectancy, 2025 statistics shows that our life expectancy is about 56 years, and it's one of the lowest in the world. Amazingly. Some other African countries, their life expectancy, like especially in Northern Africa, they're about 70-something years. So life expectancy is that yardstick with which you assess the healthcare of the people and their tendency to live. For instance, if somebody is born today and he dies in 2 years' time, he died at 2 years. If someone is born today and he dies at 90, You add the two together and you find the average. That's the life expectancy. So when the life expectancy is low, it's a test of many things. It's a test of the healthcare system. It's also a test of other things like the economy, the socio-cultural factor, the education, and the politics. Because all those are the things that contribute to people being alive. So you're seeing that the healthcare is more than hospital. It is a function of the entire societal structure and the organization of the healthcare too. That's what we talk in terms of health systems. In terms of health system, Nigeria is one of the lowest in the world. 187 countries were assessed in terms of health systems. We were only better than 3 countries.
What do you mean by health systems?
The health system is all these things that flow into health that I've just been talking about. Yes. Because it's not just hospital. Even data. How different things interrelate to bring about good health for the people. Budgeting, how much is coming into healthcare? Okay, how is the food available to improve nutrition? What about the education of the women? Women, how many women are able to go above primary school or secondary school? As Minister of Health, I must be interested in how many girls are finishing secondary school. Because if the girls are not finishing secondary school, no matter what you do in the hospital, their children are going to be dying. Because they don't have the capacity to take care of them. If people are not gainfully employed, they are going to be involving in prostitution. And HIV is going to be increasing. So I must be interested in what the coordinating minister of the economy is doing. Yes, because all those, one way or the other, they flow into healthcare. And they determine the well-being of the people. If we get leadership correctly, most other things will fall in place. That's the truth. If we get leadership correctly, insecurity problem will be solved. We'll be pretending if we don't know that insecurity has a bearing on health. If we get leadership correctly, the economy would be healthy. We'll be pretending if we don't know. If we will be lying if we say we don't know that the economy has a bearing on healthcare. Putting the right people in the right places is like square peg in square holes. I'm looking at the bigger picture now. Because if I'm talking just about hospitals, I'll be talking about 20% of the problem. Yes, the problem is beyond the hospital. If the economy is good, doctors will not leave. Because most doctors want to work in their country. But because the economy is battered, they are checking out every day. So even the few doctors that are on ground to take care, they are no longer on ground. So even the few ones now are overworked. So if the economy can just go back to what it used to be, doctors will start returning back to the country. We are more into secondary and tertiary healthcare. That is not where people are dying from. Majority of people are dying from preventable diseases, and that's the unfortunate thing about Nigeria. And that's why our statistics are very scandalous. See, when a child is born today, what is the probability that the child will get to 5 years old? The number of children that die before 5 is huge. When a woman gets pregnant today, what is the probability that woman will not die from her pregnancy? But you see what? These are primary healthcare issues.
Yes.
Immunization, antenatal care, those are basic issues. And we are failing in those things because our numbers in terms of maternal mortality, in terms of childhood mortality is still high. That's why our life expectancy is also low. If we are to look at the picture with the broader lens, then these are the issues. How we have to look at how all these socio-cultural factors, the political stability, how it flows into healthcare.
One more word, close the gap between 65 years and poor health care delivery. Let's still say one or two words to close that gap. And we do. What do we do to close that gap?
So anyone that was close the gap, the single most important thing is leadership. leadership would affect everything. It will determine, when you get the leadership right, every other thing will fall in place. Leadership is so important. Leadership in healthcare, national leadership, it will help to prioritize investment in healthcare. It will help to put the right people in the right places in the agencies of government. And there will be an amalgamation of forces to improve the well-being of everybody, including women and children.
Thank you for talking to us at Nigeria at 65. Thank you for talking to us on Nigeria on the challenges and prospects, especially in the area of this around taking the whole health sector to actually interrogate 65 years with whether improved or unimproved healthcare. But we believe that if we involve you again, you give us more light on what to do.
Yes, I can.
In the area of primary health and secondary healthcare.
Yeah.
Thank you, sir.
You're welcome.